the agenda for today, we're going to talk about the progress and the impacts, what we're seeing, what the data is showing us. We'll hear a little bit from the University of Notre Dame research team, and then we'll talk about the future. So just to ground us, for those of you who've been with us for a while, we started the homelessness prevention pilot back in 2017 with a really small amount of money. It was largely private money, but because Santa Clara County utilizes a collective impact model via like a public-private partnership. We never do these activities alone because our eye is always on how do we change the system to work better for our people. And so a nonprofit creating a prevention system outside of the governmental system won't be as, in our opinion, as fruitful as what it could look like if we worked on implementing a system together and then agreed that this would be the way that our system would respond going forward should this pilot actually be successful. And so when we were setting the table back in 2017, we had our partners from the city of San Jose and the county of Santa Clara with us, even though the dollars largely came from the private sector. In fact, our first contributor was the Packard Foundation. But we do that on purpose to make sure that over the long haul, that this can become something that the system can adopt. So if you go to the next slide, we can see where we're at today. So today, it's a little bit of a reverse. The private money is less. Our budget is a lot higher, almost $30 million. We've grown our capacity and our public sector contributions have grown immensely. And that's an important thing to remember when you're starting out is that if you build it, they will come. If you have a model that's working and you have a way to show that we're making an impact on preventing homelessness, you're going to be able to have your public sector partners who should want and will want to be interested in what we're doing. But the key, we believe, is to be doing this from together from the beginning. So in the last 7 years, we've grown our capacity. Our budget is obviously grown a lot. And we've also passed a ballot measure. San Jose passed a ballot measure that included funds for prevention. And we've been able to take the opportunity to blend other public dollars into the system, which has now created the budget that you see today. So as we go through this, the conversation today, one of the things that I think is important for us to remember is we have to plan for the future. What do we want the system to look like? Get started and know that you're going to keep iterating along the way. So with that, I'm going to turn this over to my colleague, Erin Stanton at Sacred Heart Community Services, which has been our network coordinator of the homelessness prevention system since 2017. Hey, Erin.
Thank you, Jen, and good afternoon, everyone. As Jen said, I'm Erin. I work on the network coordination team for the homelessness prevention system at Sacred Heart Community Service. And I'm going to talk to you a little bit about our network, the work that we do, and the impact that we've had over the past several years since we started in 2017. So when we started several years ago, we started with a network of about 7 organizations. And as the system has grown and evolved, we've grown our network to our current partnership of 19 organizations that you can see on the slide. These 19 organizations are across all of Santa Clara County from Gilroy to Palo Alto, and they bring a wide range of communities that they're strongly connected to, areas of expertise and their services. And all of that is really important for our system because it promotes the accessibility for people across the county to access services, and it helps us provide the most effective services as well. Just a few examples of that, we have St. Joseph's Family Center that is deeply connected to the community in Gilroy and South County. ICANN, deeply connected to the Vietnamese community in San Jose. We have Housing Choices, an organization with deep expertise in working with households with disabilities. And we partner with Aki Community Solutions, Nextdoor, and YWCA, who are part of the Domestic Violence Advocacy Consortium because they can combine homelessness prevention services with support for survivors of domestic violence, sexual assault, and human trafficking. And what do we do as a network? Our purpose is to prevent homelessness. So we work with households that are currently housed, but at imminent risk of losing their housing and becoming homeless. When we first connect with a household, the first thing we do is address the immediate crisis because families are about to lose their housing, about to become homeless. The most common thing that we do at that point is we pay the rent. We pay past due rent, we pay current rent so that a family can stay housed. We might also connect the household to our partners at the Law Foundation who provide housing related legal support, particularly with eviction defense. So if a household is facing an eviction, we're going to address that. Sometimes it's not possible to save the current housing, or it might not be safe for the family to stay there. So in that case, we're going to help them access temporary safe shelter, whether with family and friends, in a shelter, or with a hotel stay. Once we address that immediate crisis and the household is somewhere safe where they can stay, then we're going to work on our plan going forward. We're going to partner with the household to develop a housing stability plan to support them with staying housed in the future. Our program is very flexible, so that looks different for each household, but on average, we're working with a household for about 6 months. The most common thing we do is financial assistance. We pay the rent, other housing related expenses, and other flexible financial assistance to address barriers like, say, transportation or childcare. We have access to housing related legal support, and we provide case management support to partner with that household. That might mean helping them access other resources, helping with things like mediating with the landlord, financial coaching, assistance applying for benefits, whatever is going to support that household in stabilizing their housing. Next slide, please. And now I'll shift gears a little bit to talk about the impact we've seen to date and some of our data. So since 2017, this network has supported almost 25,000 at-risk families in our community. 7,000, a little over 7,000 households served through the core homelessness prevention system that we're talking about today. During the COVID pandemic, we expanded our network, we expanded our partners, and we invested in some really significant emergency programs and assisted over 17,000 households with emergency COVID relief programs. Next slide. Throughout all of those programs, we've distributed $117 million in financial assistance. That's direct financial assistance going to pay the rent, money directly to people, money to pay for other expenses. That's a really significant investment from our community in keeping families housed here in Santa Clara County. 39.6 million through our core homelessness prevention system, 77 million through those COVID relief programs. So what happens when we do this? We started, and this was a pilot, and so we were testing it. We were testing to see, does this work? Is it effective? And we have found that it is. 94% of families remain stably housed while receiving prevention services. And among families that were stably housed when they stopped receiving assistance from this program, 2 years later, only 7% of those households had become homeless. When we started, we were pretty confident about that first outcome. It seemed pretty straightforward that if we can pay the rent, people can stay housed. But we were not confident about the second outcome because this is a temporary program and our community is facing huge systemic challenges: lack of affordable housing, lack of living wage jobs, broken immigration system, broken healthcare system, all these big systemic things that we're not fixing in a temporary financial assistance program. And so families are still facing that. So we didn't know if there would be a lasting impact, and we have found that there is. We haven't solved the big problems. We still need to figure that out as a community. That's really important. But we have found that by providing a temporary safety net during a time of crisis, we can have a lasting impact in keeping families housed. Our average financial assistance is a little over $7,000 per family. And that's really nothing when you think about the costs when someone becomes homelessness of all of the systems and services that are involved, let alone the impact to that family as a result of experiencing homelessness. Quick snapshot, who are we working with? Who's coming into our program? 90% of households are extremely low income. 60% of households have children. Among our heads of household, 84% of people are people of color, 76% are women, and 20% are seniors. We see here those systemic impacts, structural racism, all of the things that are pushing people of color into homelessness. We see that here. Things like a lack of affordable childcare or paid family leave impact families. Struggling to pay the rent on a fixed income that doesn't keep up with the cost of living, that impacts our seniors, etc. Next slide. And a little more detail on what we're seeing with folks coming into our system. 73% have a disability or chronic physical or mental health issue. This is a huge factor in being at risk of losing housing and becoming homeless. Almost half have experienced homelessness in the last 3 years. So we see that ongoing challenge of housing stability. 28% have a history of incarceration, and 24% are survivors of domestic violence. So again, these systemic challenges that impact who is at risk of homelessness and who we need to support to maintain their housing. When we first work with a household, one of the first things we ask them is what is the primary reason why they're at risk of becoming homeless? And one thing that has stayed consistent since 2017 is that always, far and away, the most common answer is, I can't afford to pay the rent. At the end of the day, there are so many challenges in our community that we're working on, but people can't stay housed because they can't pay the rent. And that's why so much of our focus has been financial assistance and getting that directly out to our community to keep people housed. And with that, I will pass it to my colleague, Chad, who's going to take the next section.
Thank you, Erin, so much. It's always a pleasure working with you. Erin and I have been working on this project for 7 years now, which is incredible, and we're very grateful to Sacred Heart Community Service and all of our partners. Without the partners, without the folks in the community helping families, none of this would be possible. And in spite of all of that effort and all of those households served, we're seeing the need rise more than ever. Coming out of the pandemic, all of the COVID era protections and financial assistance and eviction moratoria have ended, and we're starting to see the impacts of that. As well as we're all pretty well aware, rents continue to rise, inflation is higher than ever, and our folks are really up against it. Here locally in the homelessness prevention system, 54%, so over half of the families are considered 100% rent burdened, which means, according to their budget and the amount of rent that they're paying, that 100% of their income goes towards rent. So it's really clearly to see why a lot of families are falling into at being risk of homelessness and kind of coming into the homelessness prevention system. You also can see that just in the last 12 to 18 months, there's been a 12% increase in rent. And we know that there has not been a corresponding increase in income, for example. Also, in coming into our system of care in Santa Clara County, we are seeing, a huge rise in the number of families who are coming to the system and saying, we are homeless for the first time. That's what you're seeing on this chart. Into the homelessness prevention system, just since January, so over the last 3 months, we're seeing a 35% increase in assessments into the prevention system. So people are coming and asking for help more than ever. And so the need for homelessness prevention services that we've been describing is more than ever. And right now I'm going to pass it to our partners at the University of Notre Dame's Lab for Economic Opportunities. David is another person, David Phillips, that we've been working with since the beginning, so over 7 years. And so I always say, like, if you don't take our word for it, take the word of the experts. I'm going to pass it to you, David.
Thanks so much, Chad. As Chad said, my name is David Phillips. I'm a professor at the University of Notre Dame at the Lab for Economic Opportunities, or LEO here. And yeah, I've been working with Chad and Erin and many others to learn exactly about this, about how much of a difference does it make when we try to prevent homelessness using emergency financial assistance. And so that resulted through everybody working together and what we believe is the first randomized control trial studying emergency financial assistance for people at risk of homelessness. It's a study that's going to be published in the Review of Economic Statistics. You can see the nice image of the full article. There's a nice long article you can read if you like. I'll start though just with the headline, which is that it all kind of boils down to this, right? People offered emergency financial assistance were 81% less likely to become homeless within 6 months of enrolling in the study and in the program. That's a huge that's a huge decrease. Now, how do we know that? If we could go to the next slide, we talk a little bit about how we came to that conclusion that this program makes such a big difference in people's lives. So we operated a randomized control trial. This is the sort of clearest type of way that you can test and highest quality evidence you can get on effectiveness of a program or really any intervention, right? Your medicine cabinet is full of things that were tested by randomized controlled trials. So what do we do in a study like this? So what was happening when we started the study is that lots of people were requesting this type of assistance, more than could be served by the homelessness prevention system. And so people were already being turned away. And when all of us were talking about that situation, came to the conclusion that a randomized control trial, a random selection process would both be fair, given that there's more people that need assistance and could really use it, then there's money for it, then a fair way to decide that is to have a computer draw names out of a hat. And the second thing that does, it also allows us to learn about how much of a difference this makes, right? If you have two groups of people, both of whom really need assistance, right? Every person in each of those groups is unique, has their own strengths, their own barriers. But if you randomly, drawing names out of a hat, decide some people are in one group and some are in the other, those two groups of people on average are going to be quite similar to each other. They're going to have similar experiences on average, except for one thing. In this context, that random drawing of names was used to decide who was offered emergency financial assistance. And so then you have two groups of people starting off in a similar spot. You can look and see what happens to them after the fact. And if there's a difference after the fact, it's because of the assistance, not because of something else, some difference in where people started off. So where do people end up? That's what the graph on the right side of your screen shows. So the bars that are in that graph are showing you what people's experiences were after entering the program. There's two groups of people again, right? There's what here in academic language we're calling control group. That's folks who applied, but unfortunately there wasn't funding to offer assistance to them. There are people in the gold bars in the gold group. That's people who were offered emergency financial assistance. As we go from left to right, you're going through time. So people enter this study and request assistance all the way off by where it says 1. And as time goes on, you're moving from left to right, and those bars are getting bigger and bigger. Why is that? That's people entering homelessness. So that's showing as those bars get bigger, that somebody shows up in emergency shelter, they have contact with street outreach. That's the cost of going from being at risk of homeless to becoming homeless. I think what you'll notice if you look at that graph is those blue bars start growing really fast, right? People who are not offered emergency financial assistance do end up showing up in emergency shelters, having contact with street outreach. They end up becoming homeless. By the time you get to 12 months later, though, what else is going on? Those gold bars aren't growing nearly as fast, right? Those folks who started off in a very similar situation are much, much less likely to enter homelessness. In fact, they're about 3 times less likely to enter homelessness. And so that gap between the blue and the gold bars, that's showing you the difference that this type of assistance makes. It dramatically reduces the risk of homelessness. Two other things that I'll say before handing back. One is that notice that those bars keep getting further and further apart. They don't sort of get apart and then narrow back down and get close together, right? If emergency financial assistance was just sort of kicking the can down the road, just a temporary Band-Aid, right? You might see these sort of bars grow apart and then come back together, but you don't see that. You see them keep on getting further and further apart. That's an indication that emergency financial assistance is preventing homelessness, not just delaying homelessness. The other thing I'll say is that you might be wondering, okay, how big is that? It looks big on the graph, but how big is that? And that's a more complicated question, how big is big? But one thing we did in the study is try to add up how much benefit do you get when you spend $1 on this type of program, and try to add up benefits to the recipients, try to add up other benefits to the community. And we came up with what we think is a conservative estimate, but as best we could add things up, about $2.47 of benefits for each dollar spent on the program. So to us, it looks like from the study that we did, this is a program that is preventing homelessness and is having a big impact in your community. And so then I think at that, I'll pass it back to Chad. And thanks so much.
Thank you, David. So just a quick reminder, if you have any questions, please feel free to throw them in the chat. Folks on our team will either try to answer them in real time in the chat box, or we will bring them to the forefront for discussion if they're particularly juicy, and we'd love your questions. Kind of wanted to come back to, why we decided to have this public webinar, which is to kind of show the progress of our homelessness prevention system and talk about how it's a great example of system change and building a new system for preventing homelessness in Santa Clara County that we do feel like is replicable. Just remember, back in 2017, we started with a humble pilot, mostly private funds, serve about 200 households and just see if it works, to try this in a new way and capture data to show that it works. Quickly, we saw some success, and so we went into kind of a growth phase where we were also iterating on the programmatic components and kind of setting up the system with the network coordination team and all of the partners in a way that became effective and culturally competent and had a wide net across our entire county and started to have a capacity to serve enough households to actually make a dent, right? To actually, be relative to the need. Then, all along we had the University of Notre Dame, evaluating the system to make sure that we had third-party validation. Of course, we went into this thinking like people need money and providing financial assistance quickly was going to help people prevent, becoming homeless. But again, no real effort at that time had been made to prevent homelessness in a systematic way. And so we wanted to make sure that that was actually the case. And so that's the power of having this evaluation from the University of Notre Dame that was published and is available to communities across the country and in our own region. So in order to really make the system change lasting, it's time for us to pass the baton to the county's Office of Supportive Housing, and our governmental institutional partners who will be around a lot longer than we will be and will always have more funding to kind of sustain a system like this. And so we're really excited that this, starting July 1st marks that this transition will be official. The county, who operates our coordinated entry system in Santa Clara County, will be, incorporating homelessness prevention as alongside other, permanent housing and shelter services as core interventions for how we prevent and end homelessness in Santa Clara County. So with that, I want to pass it over to Catherine Kaminsky, our colleagues at the county, to kind of talk in more detail about the transition.
Thanks so much, Chad. Appreciate that introduction, and I'm so excited to be here to talk about this today. I reflecting on how far we've come, I am so grateful that we have a partner like Destination Home who takes these big ideas and figures out how to implement them, goes through the painstaking process of trying new things, measuring those successes, measuring what's working, what's not working, and making those changes along the way, and bringing together all the partners as they do so successfully, as Jen talked about earlier in the presentation. So now that Destination Home has done a lot of the work in partnership with the county, the city of San Jose, and of course Sacred Heart to develop this system, this feels like it is the right time for it to become part of our a permanent part of our supportive housing system. It's a great example I see of systems change in a relatively short period of time, as well as a highly successful public-private partnership. While the county is taking over the sort of lead role, Destination Home isn't running away. We're so grateful that they're committed to being a part of this system and maintaining this public-private partnership and continuing to support with both their expertise and funding as well. But we think that this integration into the county will open up a lot of new possibilities as well. We are committed to making sure that we remain a nimble system and maintain that approach to be innovative, try new things. This system has been successful because Destination Home and the existing partners have done that really well, and we want to continue to do that, while also making sure that the folks that are receiving services aren't seeing a big change. We're not, we want to make sure that the system stays accessible, meets people where they are, maintains the flexibility that has been such a key part of the success since its launch. So next slide, please. So I think one of the reasons HPS is so critical to our efforts to end homelessness is because we unfortunately continue to see people being pushed into homelessness, experiencing homelessness for the first time. What we want to do as a community, as a continuum of care and at the county here is get to a point where more people are being housed every year than are being pushed into homelessness. We know that our efforts to move people out of homelessness and into permanent housing are working. We're housing more households every year than we ever have before. on this chart, that's the blue bar, and you see last year over 2,500 households moved into permanent housing. So we know what we're doing is working. We continue to expand our housing programs, but we also still see, last year we saw almost 4,300 households request housing assistance for the first time. So that number remains high, is persistently high because of all the economic factors that Erin touched on earlier, the lack of affordable housing, and the homelessness prevention system is a critical piece of making sure more people aren't falling into homelessness for the first time. We know it's not the only solution, and there's a lot more we have to do to address all the root causes of homelessness. But without HPS, I have no doubt that we would have seen many more households experiencing homelessness every single year, and this is a critical part of our system. And as I talked a little bit about our commitment to maintain flexibility, we also want to be able to work across our county systems in a more integrated way. I want to hand it off to my colleague, Jessica Orozco, a program manager for homelessness prevention services, their system here at the county, to talk about some of the opportunities ahead of us.
Great. Thank you, KJ. Good afternoon, everyone. I'm really happy and excited to be here with you guys today. As much as I don't love presentations like many of you, this is just a really exciting way to look back at the 7 years that we've been working on. So I really can't help but feel a really good sense of pride and excitement. Over the years, we've continually strived to better understand and support at-risk families, as you've already heard. And from the start, we knew what we really knew is we had to be flexible and creative in our efforts. We knew that this was going to have a positive impact, but we really wanted to have a better understanding of the challenges facing at-risk families. And we knew that it really was going to demand solutions that were creative and dynamic and effective and long-lasting, which I think we've really seen through these last 7 years. As a result of the study and the flexibility, we've embraced many challenges along the way. We've learned a lot from the data. We love our data. We learned a ton from the LEO study, of course, from our partners. And throughout all of this, we made adjustments along the way. Through our collective dedication, through our innovation, we're really ready to continue to push the boundaries of what's possible and continue to see that lasting difference. So now I get to highlight a little bit of the new approaches for HPS that are based on all of the learnings, the study findings, and the system-wide data. So county data integration, that's really going to serve as a basis so that we could prioritize and coordinate various prevention efforts, hopefully optimizing resource allocation because we know the need is so great. We're hoping that the data integration will help us advance innovations. We're going to consolidate and analyze the diverse data sets so we can really pinpoint high-risk areas and identify vulnerable populations so we can tailor our interventions for maximum impact. And then more exciting than data, I'm sure, shallow subsidies. Shallow subsidies for households that require longer support emerged as a critical priority as existing systems fail to adequately address their unique needs. So for example, a household in which somebody is experiencing a health condition might need financial assistance for a set period of time in order to receive treatment or recover. And so with shallow subsidies, we can bridge the gap and ensure that that household receives access to the essential support services that are needed and that maybe traditional systems cannot fully accommodate. Then, of course, flexibility. I know everybody's very interested in maintaining flexibility. We know it's essential, especially in addressing higher dollar cases, to effectively navigate complex situations. And so we want to make sure that we continue adapting our approach to accommodate the complexities of each case, and we can ensure comprehensive support. Affordable housing for prevention, very exciting. It's truly an innovative step. We're launching a pilot program to reserve some affordable housing units within our developments that are specific for homelessness prevention clients. While previously these affordable housing units were limited to permanent supportive housing recipients and rapid rehousing, this initiative really marks a critical expansion to encompass homelessness prevention as a part of our wider system. And even just as exciting as affordable housing is guaranteed income. Building on our progress, we're committed to advancing guaranteed income initiatives. But I'll go ahead and pass it over to Jen because she has much more exciting things to say about guaranteed income. Thank you.
Jessica, and thank you, KJ. We're ready to let our baby go off to school, but we'll still help pay the tuition. How does that sound? So one of the, and in addition to, I think, spurring real public sector interest in preventing homelessness, which frankly is a new thing across the nation in the state of California in individual communities, giving cash to people. This has not been going on forever. In fact, the federal government included homelessness prevention in the federal strategic plan for the very first time in the last couple of years in our nation's history. We haven't, as a nation, funded these types of activities before. And so from a culture perspective, we're excited to see not only looking at prevention, but our community, especially under the leadership of the County of Santa Clara, taking also guaranteed income pilots on and running those. We have pilots for homeless families or at-risk families. That's in partnership with the Si Se Puede Collective. We have a pilot coming up for folks leaving incarceration, young moms, where we want to do a pilot for undocumented ELI seniors this year because of the rent burden and how we're seeing too many seniors become homeless. And all of that is possible because we all started this work around giving cash to people together. And then next on the horizon past guaranteed income actually is we are looking at doing a baby bonds program, which would really be our first foray into wealth building. And we would be targeting the babies that are born into homelessness every single year. So we look forward to coming back and talking to you about that pilot as it continues to grow. But what is next for our work on this system? We want to talk a little bit about what's going on nationally. One-time assistance or five-time assistance isn't the same as having rent you can afford. Our nation is reaching crisis proportions now, with nationwide nearly half of all renters are rent burdened. 26% of those are severely rent burdened. This is an all-time high, and it's due in large part to our inability on a national, statewide, or regional level to build deeply affordable housing for people for decades and decades and decades. And so now we are in a crisis that will affect our labor markets, education, health, all of the domains when families do not have the money to pay rent. So we're hoping to make a small contribution to that crisis, given the opportunity that we have with the randomized control trial that we have. And so what we're hoping to do next is we are partnering with the United States Interagency Council on Homelessness, Cisco, University of Notre Dame, to talk about how we can replicate and support other communities in this country with replicating the system. Many communities don't have cash aid systems, and others are under-resourced. They have a system, they have people who are eager to run it, but they don't have the resources to be able to do it. So look forward to more coming from us about that in the coming months, but we're excited to see how this research and this work can contribute, hopefully, to alleviating rent burdens across the country. And with that, I think we are at time for questions.
That we are, and we have some great ones in the chat. The first one here is a great segue from what you were just talking about with this replication. What advice do you have for other orgs or communities who are thinking about deploying this type of program?
I think it's really important to know what the problem is you're trying to solve and where do you want to go. And what I mean by that is lots and lots of people are struggling to pay their rent, but only a percentage of those folks will become homeless. And we have tried to isolate and understand and study those conditions that contribute to a family becoming homeless. And overwhelmingly, the number one concern is families that are extremely low income households. Anybody at 0 to 30% of area median income not only has far less choices in the marketplace for housing that they can afford, but also is really severely rent burdened month over month. And so knowing that you are wanting to solve that problem of families or individuals becoming homeless versus a general rental relief program, which that is okay too. But how you do it really matters. And I believe, and we believe at Destination Home, that the coordination with the public sector is the #1 most important thing. Too many times nonprofits try to go it alone and then they run an incredible pilot, but then it doesn't scale. And then it's not able to be used to help more people. And so our philosophy, even though sometimes it takes more time, is that we do this work together because we are committed to the same work. And that's because we have one unified community plan to end homelessness. And someone can pop that in the chat, that our county operates under. And so all of our activities fit under the community plan, and there's a shared sense of responsibility in fulfilling those goals.
Thank you.
Other question?
Yeah. We have a question here about how our program prioritizes who receives assistance. Maybe Erin, that's a good question for you to speak to.
Sure, I'd be happy to. So in Santa Clara County for the homelessness prevention system, we have eligibility criteria, which is that we're working with folks who are currently housed but at imminent risk of homelessness, which we define as being within 2 weeks of losing your housing or missing a rent payment that could cause you to lose your housing. And then you also have to be low income, and you do have to live in Santa Clara County. We are focused on Santa Clara County. Obviously, there are far more folks who need this assistance than we can support, so we prioritize based on vulnerability. We use an assessment tool called the Homelessness Prevention Assessment Tool, or HPAT, that we developed with the support of our wonderful colleagues, David and the other folks at the University of Notre Dame, based on the data from our first few years of running HPS. And it looks at 10 questions looking at vulnerability factors that we have found make people at higher risk of becoming homeless, because not everyone who's facing a risk of eviction or struggling to pay the rent will become homeless. Some folks have other resources, other support systems they can lean on. So we're trying to prioritize those who are most likely to end up unhoused.
Thank you. So we received this question when, Jessica, you were talking about some of the exciting opportunities with the transition to the county, and a reference to direct referral to affordable housing developments. The question was, where are these affordable housing developments being built? And so KJ or Jessica, maybe it would be great if you could speak to that.
I can take that one. Thanks, Chelsea, and thanks for the question. And there was another question too about sort of what the county's efforts are on developing affordable housing and supportive housing. So I put a little bit of information about our 2016 Measure A housing bond and the tremendous progress that has been made. We have 56 developments, either under construction, open, and tenants moved in, or we've committed funding to them, and they'll be developed in the near future. And that's over 5,000 new apartments and almost 700 renovated units. So those are all over the county. Right now they're in 10 cities across Santa Clara County. The pilot is in, actually, which city is the pilot in, Jessica?
It's City of Mountain View.
In the city of Mountain View. So it's one development that we're starting with. And that one happens to be in the city of Mountain View. But we are gonna, measure the success of this and look at, the potential to expand to other developments in the future too, which, as I said, are in every community across.
Thank you, KJ. Just a few more questions here, and if there are any others that come to mind, we might have time for a few more, so feel free to drop them in the chat. So understanding, the success of our local program here, what is the biggest challenge that lies ahead in continuing to sustain and scale the program moving forward?
It's money, right? So prevention activities are not funded through a variety of mechanisms, and so being able to raise the funding to do that is significant. And I also think culturally, people with those resources understanding the importance and agency of letting people be able to solve their own problems and provide that sort of resources, and that is a wonderful, impactful thing to do.
And sorry, Jen, I might have just missed this, but we did get a great question about how folks can get involved if they want to be a part of future initiatives like this.
So all of the work that we're talking about is done in partnership with our nonprofit community. So depending on where you are or who you work for, there could be opportunities to help us execute on some of these new emerging projects. And so as those opportunities are being brought forward, we'll make sure that we share them really widely.
Thank you. We have one last question in relation to the randomized controlled trial that David was telling us about. Slide 17 was up, and the question is if the information is broken down by demographics. David, are you able to speak to that?
Sure. We did try in the evaluation to look at, for instance, yeah, how does the effectiveness of emergency financial assistance differ for different groups of people? It's a little bit difficult to tell just because of the number of people that were in the study. So the study, we didn't talk about this, but it didn't include everybody in the prevention system, which is quite large. It included a few hundred people. And so it's a little bit difficult to sort of split that up into particular groups. Although a couple things that we did see. So one thing that you see is it looks like prevention assistance makes a bigger difference for people who have a history of being homeless before, which makes sense that just because of them being highest risk. But it's hard for us to say. There's a lot of other, I think, important questions that people have about who benefits most and equity and things like this that are a little bit hard for the study to look at just because of the number of folks that were in the study.
Thank you all so much. I think that covers the questions that we've received so far.
Okay, so thanks for joining us today. If you want to have more information, you can scan that QR code that you see on your screen. And for those of you who've been following along since the beginning or over the last few years, we're going to continue to host these briefings in partnership with the county. We're going to continue to maintain this level of transparency as this becomes absolved into the system of care. So thanks for joining us today and have a great rest of your day.